Prediabetes is a lot more common than you think. You might have it and not even know it. If you've been diagnosed with prediabetes, you have a relative with diabetes, or you want to prevent diabetes from appearing, this video is for you. In today's video, I'm going to reveal how to reverse prediabetes naturally and effectively before it's too late. Hey guys, Dr. Gus here, naturopath, acupuncturist, conventional doctor, and founder of drlandivard.com. In this channel as a conventional doctor, I treat my patients through natural medicine before recurring to the use of pharmaceutical drugs. So if you're new to my channel, consider subscribing and press that bell down below to receive notifications and be the first one to watch the new video. If you need to line an appointment or quality supplements for your disease, visit drlandivard.com, and I encourage you to stay till the end of this video, where I'm going to reveal extra tips and video links related to this topic. Prediabetes is a condition where the patient is halfway into developing full-blown diabetes. At this stage, you have the chance of reversing this disease completely or falling into a chronic health condition that has horrible consequences in the future, which include, for example, blindness, amputations, kidney failure, strokes, heart attacks, and even death. Millions of people have prediabetes and don't know they're halfway between diabetes and a healthy lifestyle. And believe me, you do not want to fall into this disease. Type 2 diabetes is a dangerous chronic disease that can lead to many other health conditions. According to the National Diabetes Report, over 30 million people in the United States have diabetes. That's an alarming 10% of the population, not including countless others who live with diabetes for years without even knowing it, and with the possibility of reversing this condition before it's too late. So in today's video, I'm going to reveal how to reverse prediabetes naturally and effectively before it's too late. I'm going to divide this treatment into three very important sections: lifestyle changes, your diet, and supplements. Every part of this video is important, so make sure to pay close attention because each section is dependent on the next. Number 1, lifestyle changes. I cannot stress enough how lifestyle changes are important. If you have prediabetes or diabetes, you must change your daily activities to favor a healthy lifestyle. Number 1, exercise. Exercise is extremely important. You need to exercise every single day. Let me put this into perspective. If your body's not being able to burn sugar and glucose is circulating without being used up, it'll continue to rise constantly over the course of hours, days, or even weeks. Exercise is one of the only ways your body can make your cells become more receptive to insulin. And if you have prediabetes or diabetes, this is a must. By all means, you need to exercise every single day for at least 15 minutes. Go for a walk, swim, bike riding, anything is fair game when it comes to exercising and diabetes. You don't know how much difference this is going to make. After a couple of days, sugar is going to start to normalize in your blood and everything will be much better. Number 2, diet. Number 1, foods to remove from your diet. Many foods will increase your blood sugar levels and create spikes that cause inflammation and immune responses. These end up being counterproductive on your pancreas, so in order to reverse diabetes or prediabetes naturally in this case, the first step is to remove the foods that I'm about to mention. Refined sugars. This one is a no-brainer. Refined sugar is going to rapidly rise your blood sugar levels, so try to stay away from any sugar-containing foods. This category includes any sodas, fruit juices, or any sugar-containing beverages. All these are going to have terrible effects on the body, so try to stay away from them. Instead of using refined sugars, I suggest you use natural sweeteners, like stevia for example, which is actually the best choice for pre-diabetic or diabetic patients. Other natural sweeteners can be, for example, raw honey or maple syrup, but they're not so great, so try to avoid these. Grains. Just in case you didn't know, all carbohydrates you ingest are quickly broken down into sugars. I know of many people that consume no sugar, but when asked if they consume breads or pasta, they don't realize that these foods are becoming the same sugar they're trying to avoid. So stay away from gluten-containing grains, especially wheat. Gluten consumption can cause intestinal inflammation, which affects hormones like cortisol, leptin, and can cause blood sugar spikes in the blood. Hydrogenated oils. When treating prediabetes, it's important to remove every hydrogenated oil you're having in your diet. So for example, vegetable oils, soybean, cottonseed, corn, canola oil, all very important. Any of these oils will cause inflammation simply because these oils are processed and treated at very high temperatures and combined with bleaching agents, artificial dyes, and consuming them has been linked to many other health conditions, including diabetes and prediabetes. Alcohol. In case you didn't know this, alcohol rapidly increases blood sugar levels and can lead to liver toxicity. Newly published studies say that there is a 43% increase in prediabetes incidence and diabetes in people who drink alcohol 3 to 4 times a day, so stay away from alcohol. Conventional dairy. Another very important group of foods to eliminate is conventional dairy. You see, a substance called A1 casein is produced by conventional cows and has been linked to autoimmune conditions like diabetes, even autism. This substance can lead to harmful states in the body, triggering an immune response similar to gluten, so stay away from these conventional milks, dairy products like yogurt, cheese, etc. Number 2, foods you should be consuming regularly. To reverse prediabetes, it's important not only to remove foods, but also adding some of the richest foods and highly beneficial foods to your diet. Some of these are the following. Fiber-containing foods. I don't know if you knew this, but 90% of the world's population doesn't consume enough fiber on a daily basis. And the most important thing about fiber, or what fiber does, is it helps slow down glucose absorption, regulates your blood sugar, and supports the detoxification process, all of which obviously are very important in prediabetes conditions. So aim to consume fiber in every meal. Some of these include nuts and seeds, flax seeds, chia seeds, and green vegetables. Foods high in chromium. Chromium is a very important mineral involved in carbohydrate and lipid metabolism, and foods that are high in chromium can improve the glucose tolerance factor in the body and naturally balance out blood glucose levels. So foods that contain chromium are, for example, broccoli, green beans, and organic grass-fed beef, obviously. Magnesium-rich foods. Just like chromium, magnesium can help regulate your blood sugar levels because it plays a role in glucose metabolism. It's so important that research shows how prediabetics and diabetics are frequently associated with a magnesium deficiency in their bodies. Foods high in magnesium are, for example, lettuce, kale, pumpkin seeds, almonds, and even black beans. Foods low in sugar content. If you're fighting off prediabetes, this is a no-brainer. You need to consume foods that are low in the glycemic index. So stick to foods low in glycemic index foods, like non-starchy vegetables, berries, nuts, seeds, avocados, coconut, organic meats, eggs, fruits, but no fruit juices. This last detail is very important. Okay, now that you have a good picture of what your diet should look like, let's jump into the third part of this treatment, supplements. Part 3, supplements. Supplements can sometimes do the trick when diabetes or prediabetes are hard to control. I know of several of my patients that do the diet, their exercise, everything perfectly, and still have a hard time controlling their sugar balance until they use a couple supplements. What's sometimes even better than individual supplements is a good formula for diabetes. If you need a supplement or a specific formula for your condition, visit drlandivar.com. Okay, so number 1, apple cider vinegar. A very interesting study from the University of Arizona tested apple cider vinegar in sugar controls and discovered that taking diluted apple cider vinegar after each meal showed a 34% lower postprandial blood glucose level compared to the controls. What you can do is take 20 ml of apple cider vinegar and dilute it in 40 milliliters of water and take a tablespoon of this mixture after every meal. Number 2, chromium picolinate. Remember how I just mentioned how chromium picolinate can play an important role in sugar metabolism? Well, taking 200 micrograms of chromium picolinate 3 times daily with your meals can help improve insulin sensitivity. A review published in the Diabetes Technology and Therapeutics in the United States evaluated 13 studies that reported significant improvements in glycemic index control, hyperglycemia, and hyperinsulinemia with the use of chromium picolinate supplements. In addition to helping you with diabetes, this supplement can lower cholesterol and triglyceride levels, so if you're not taking this yet, I suggest you do so. Number 3, bitter melon extract. This is a new discovery that has been recently getting a lot of attention. Bitter melon extract lowers blood sugar levels and it regulates the body's use of insulin. Studies show that bitter melon extract can help reduce and manage or even control symptoms in diabetes, including, for example, insulin resistance, heart complications, kidney damage, blood vessel damage, eye disorders, and even hormone regulations. Number 4, cinnamon. Cinnamon is a common supplement that can be found in any food store. You can take cinnamon powder every morning with your breakfast. This supplement has been found to decrease blood glucose, LDL cholesterol, and triglyceride levels, and is becoming increasingly popular in diabetic formulas that aid with symptoms and its sugar balance. Number 5, a good quality formula. Diabetic formulas can aid you in the management of diabetes and are many times a must. Look for the following ingredients in a good quality formula that contain some or obviously all of the following. Alpha lipoic acid, very helpful in preventing or treating diabetic neuropathies. Magnesium, many times deficient in a diabetic patient. Vitamin C, useful in controlling oxidant levels in the blood. Vanadium, vitamin K, and vitamin D. Help out the channel by giving this video a thumbs up and sharing it with your friends and family. And if you have any questions, leave your comments down below and I'll be happy to assist you. If you need quality supplements for your disease or align an appointment, visit drlandivar.com. I encourage you to check out these other videos related to this topic. You're going to find valuable information that might prevent a serious health condition in the future. Thanks for watching, you guys, and I'll see you soon.